Well, hello, everyone. This is Deidre Kindred, your nurse advocate, educator, and navigator. I am the owner of Your Healthcare Nurse Advocates, and today I get to interview a very close colleague and friend of mine, Sue Wallace. Sue Wallace is a certified senior advisor. She has a plethora of years experience in the healthcare arena. I'm going to let Sue introduce herself about a little bit more what she does or what she has done, and then we're going to get into talking about why independent patient advocacy is important. But first, let's get Sue to tell us a little bit about your history.
Well, my history is that I started the first personal assistance here in Tarrant County, as far as I know. And I had that company for over 26 years. But during that time, I found that some of my clients needed an advocate. And I found a program which is called Certified Senior Advisor. And I obtained my certification and became an independent advocate, as well as having my personal assistance company for that length of time. And then now I'm just doing independent advocacy work.
Wonderful. So, advocacy is a hot topic in our healthcare arena, but also even more hot topic is independent patient advocates. And Sue, you just had an experience where you were on the bedside as a patient versus, you being an advocate. So let's talk a little bit about that experience.
Yes, that was very eye-opening for me because I have always enjoyed wonderful health and just thank the good Lord for that. And I just haven't had the opportunity. I've done a lot of advocacy, but as far as the perspective of being a patient, I never had that opportunity. However, this kind of dropped into my lap because I not only had a severe case of COVID, but immediately I found out with no symptoms that I had a diseased gallbladder. And so I had to have emergency surgery. So I had to be admitted to the hospital. I didn't have to go through the ER. And that experience was pretty nice, the emergency room experience. However, I knew what needed to happen when you're in the hospital, and it didn't always go as planned.
Yes.
And so it really was an eye-opening experience for me.
Yes, and I like to call that a walk in someone else's shoes, because I've been a patient before. But as an advocate, when you're on the other side of the bedside, or a healthcare provider's on the side of the bedside, it's different.
It's very
when
different.
You're a patient, it's like you lose all control.
Right. That's what I felt. And it was, there were times that at the beginning, right after surgery, where I could not really, I was not in the right frame of mind to be my own advocate. Fortunately, I have a friend that is I have a nurse friend that's an advocate. And
well,
so she was there with me.
So I can attest to that, because first of all, it was, your life gets turned upside down when events happen. My pastor used to say, life happens while you're making plans, right?
That's right.
So going along, and then all of a sudden you had to go into the hospital, have emergency surgery. I knew in my heart that you were okay, but at the same token, when you're under anesthesia and you're a solo lady, you're basically, that's what we call solo senior. So what happens the day after? So let's talk about that. What happened surgery, post-surgery?
Well, the day after, the surgeon came into my room and said that I needed to go home. And I said, no, I don't need to go home because I live alone and I am working to get my home secure, where I can go home and someone could be there to take care of me or help me in case I needed it. But I'm not in that position today. and no one had asked me at the hospital. No nurse, no social worker had tried to find out what my home situation was. And here was this physician telling me that I'm okay to go home. And I knew in my heart of hearts, I was not ready to go home.
Okay, absolutely. So let's put a pin right there, because as your advocate, I was on the outskirts talking to your patient advocate in the hospital, the care transition manager. That's what they're called in some of the hospitals. They have different names, and their job is to be a patient advocate, but their real job is to get you out of the hospital as soon as possible. Right. So after talking to her, I was able to explain she's not safe the first night after surgery. The first night after surgery is the most painful night, in my opinion, because you need someone to help you to the bathroom. You need someone to help you make sure you don't fall. You need to help someone to help make sure you take your medications consistently. So with them not asking you any of those questions, I found it kind of strange, because when I was talking with your patient advocate in the hospital, at the same time, the physician had come in and talked. So that's the communication gap.
Absolutely.
Because the communication had been dropped somewhere, and you told me you never met your patient advocate.
I never met the social worker or the patient advocate. It may have been one and the same person, but I didn't know that. But no one talked to me about my situation, my home situation, and if I had someone there to, just watch after me the first night or two, whatever. So it was just a surprise when the physician told me that I was going home, that I was going to be discharged.
And you're like, wait a minute, I can't go myself tonight. And so when I was able to talk with your patient advocate there and explain the situation, she was able to get a home health order. But at the same token, let's talk about the nursing staff.
Oh my goodness. Could we talk about the nursing staff? Once the doctor was told that I wasn't going home, then from then on, when I put my nurse's light on, because I was supposed to have assistance going to the bathroom, I wasn't supposed to go without assistance. They didn't answer the call many times. It seemed like that happened, that was more prevalent during the day than it was at night. The night staff was much more engaged, I'll put it that way. But so what did I do? I mean, I just helped myself. And I could have had a fall or anything like that. But of course, I know, it's being an advocate, I know not to take any chances, and I was using the walker and all those things. And so, but I just felt like they had kind of disregarded my presence there.
And that's a true feeling. So lots of times, not making an excuse, but the nursing staff could have been overwhelmed and whatever the case may be. But at the same time, being a patient, you feel like you're forgotten about.
That's absolutely correct.
Right.
And so whenever, and there were several other things that happened because of the nursing staff. When the discharge did occur, the day that I was being discharged, the nurse that was assigned to my room came in and brought the discharge summary, and she just basically threw it at me and said, "You can read this." She didn't go through it, tell me what to expect when I got home, anything. So I thought that was kind of another ball that had been dropped, and right there. And then the other, a social worker friend of mine was there to take me home, because my family was out of town while all this was happening.
So the whole gist of this conversation with my associate Sue is that the importance of an independent patient advocate is so key, because on the outside, I was able to, number one, build her a medical village. So basically, asking the patient advocate in the hospital, say, hey, can we get another day or two because she doesn't have anybody at home. So that's speaking up for a safe discharge. I've heard hundreds of stories about people going to the hospital and the doctor comes in and they discharge them home and there's nobody there. There's no instruction on what you should do, and that's so important. So having an independent patient advocate or someone who's on your side doing the work when you can't do it because you were under anesthesia, so your mind wasn't synapsing as fast as it normally does. So thank goodness you are a patient advocate and you were able to speak up for yourself.
That's right.
No, I don't feel safe at home. I don't have nobody to take care of me. What can you do for me to make sure I get home safely?
That's right. That's right. And what troubled me after I did get home is that my heart went out to people that do not have an advocate, do not have an independent advocate to help them with these situations, because I'm pretty sure that I was not the only person that these things happen to in the hospital. Whether it be staffing problems or whatever it is, it's still not, there's no excuse for some of the things that happened to me. And I knew what should happen, but what about these people that don't have the knowledge that I have? So my heart really went out to them. And that's why I felt like it was so important that we talk about how important it is for a person that is in the hospital, especially in the hospital, especially if they've had surgery, things like that, that they need an independent patient advocate to help them.
And it's all about team building. So, getting an independent patient advocate to be on your side, whether you're in the hospital or going to a doctor's visit, is so key. I call it having a second set of ears and eyes, because that person is going to see something or notice something that you don't know or see. So with your knowledge and your background, still things were dropped because of lack of communication.
That's right. That's right. So anyway, I am so happy that we're having this discussion today, Deidre, because it's so important for people that don't have the knowledge that we do of how important it is. And I know doctors, I've even gone to doctors' visits where they have said to me, you do not need to be in the hospital without an independent advocate coming straight from a doctor. So, we know it's so critical, but we just want to get the word out that to the general public, how important it is that you do have a independent patient advocate.
Absolutely. And stay tuned for more talks in regards to advocacy for independent patient advocates. My name is Deidre Kindred. I'm an independent patient advocate, educator, and navigator.
And I'm Sue Wallace, a certified senior advisor, independent advocate.
Yes, and we thank you for your time.
Certainly.
Thanks for tuning in, and tune in next time for another amazing chat. Thank you.